looking back at the respiratory system, we are starting a new topic here, which is the lungs mechanics of breathing. So very important in order to understand the lungs mechanics, to understand the relationship between the volume of a container and the pressure on the inside. So if I have larger volume, what's going to happen to the pressure inside? What do you think? So if you have a balloon like this, it's filled with air. So this air is going to be applying pressure on the balloon. If I increase the size of this balloon with the same amount of air, what's going to happen to the pressure on the inside of this larger balloon? Increase or decrease? See, to increase, increase, increase. So let me ask you the question in a different way on here. So if I have a balloon filled with air, X amount of air, but I will be compressing this balloon. When I compress the balloon, what happens to the air on the inside? Will it start to travel out or will it remain on the inside? If you're compressing this balloon, if you're compressing the balloon, the air will travel out. And anything travels from high pressure to low pressure or from low pressure to high pressure. What do you think? One or two? From high to low or from low to high? Anything travels from high to low, low to high. What do you think? So I will tell you the question in a different way. If you have a job and this job puts a lot of pressure on you, too much pressure, and you've got a job offer with the same salary, but this other job gonna put much less pressure on you. So what you gonna do? Would you remain at the job with high pressure or would you go to the job with lower pressure? They pay you the same. Would you remain at high pressure or would you travel and go to the job with lower pressure? Lower stress, lower pressure. You're definitely gonna be moving from the job with high pressure to the job with lower pressure. So the same for anything gonna be traveling from high pressure to low pressure. Anything gonna be traveling from high pressure to low pressure. Until when? So if a new company opens, they will put much less pressure on the people, and older company has its employee at a very high pressure. As this new company gets more work to do, what's going to happen? The pressure on the employee will increase. So people will keep leaving this company company, let's say company A, and we'll go to company B until when? Until the two companies are going to be applying the same amount of pressure, so there will be no difference. So anything going to be traveling from high pressure to low pressure until when? Until I equalize the pressure on both sides. So anything going to be traveling from high pressure to low pressure until I have equal pressure on both sides. So there would be no difference to move from one side to the other. So back to our balloon here. What do you think? When you are reducing the size of the balloon, you're compressing the balloon. Air, as you've mentioned, gonna be traveling outside of the balloon. So this means what in terms of pressure? This means that you did create a state of high pressure or low pressure, A or B. Yeah. When you compress this balloon, you've created a state of high pressure or low pressure within the balloon. High pressure, right? Anybody is not convinced? Anybody is not convinced? When I compress the balloon, I create a state of high pressure within the balloon, and this what drives the air to flow out. So what is going to be the relationship between the volume and the pressure? So when I reduce the volume, what's going to happen to the pressure on the inside? So I have larger balloon and a small balloon. Having the same amount of air on the inside, the smaller volume gonna have higher or lower pressure. What do you think? Higher pressure, exactly. So what is the relationship here between volume and pressure? When I reduce the volume of the container, pressure goes up. When I reduce the volume of the container, pressure goes up. How about if I increased the volume? If I have larger volume, what's going to happen to the pressure on the inside? Having larger volume, what's going to happen to the pressure on the inside? Pressure will increase or decrease? This will decrease my pressure. So again, very important for us to understand the mechanics. It's the same exact concept like what we've seen in the heart. If you remember, when you contract the ventricle, what's going to happen to the volume of this ventricle? You're going to be reducing the volume of the ventricle. And when you reduce the volume of the ventricle, you create state of high pressure. And pressure, as the pressure of the blood increases, it's going to be moving out. Same exact concept like what we've seen with the heart. So as you increase the volume, pressure is going to be reduced. And in this case, if I am contracting the ventricle, I am reducing the volume of the ventricle, and so I have an increase in its pressure. Is this concept clear here? Very, very, very important for us to understand this concept. All right, so You are sitting now in your room or your office or your car listening to this lecture. Is there any pressure applied on you from above? Is there anything above your head right now? Yes, what is above your head other than hair? Because if you remember, I still don't have hair. You have above your head air, right? And this air goes where? Goes all the way up from the surface of your body all the way to the space. So all the air above your head until you reach the space, this is what we call the atmosphere. So this atmosphere formed by gases, oxygen, water vapor, carbon dioxide, nitrogen, all those gases gonna be sharing in the formation of the atmosphere. Each one of them has its own pressure that it's contributing applied now on your body. So all those gases together will be creating what we call the atmospheric pressure, exactly as what you've mentioned. So again, what are the three concepts on here that we've mentioned so far? Relationship between volume and pressure. As you increase volume, you're going to have a reduction in the pressure. As you reduce the volume, you're going to have an increase in the pressure. Anything going to be traveling from high pressure to low pressure until when? Until you equalize the pressure on both sides. And the third very important concept we need to remember is that you are surrounded by atmospheric pressure. We measure the pressure in millimeter mercury. This is the unit that we use to measure the pressure. The atmospheric pressure is equal to 760 millimeter mercury at sea level. So if I am at the sea level, it's going to be 760 millimeter mercury. Why we say at sea level? Because if you travel up on a mountain, you're gonna have much less pressure applied on your head. Because remember, what is determining the atmospheric pressure is gonna be the amount of air on top of your head. So at sea level, this is something constant everywhere. Water will not travel all the way to the top of a mountain. All the seas will have the same level. So something constant that we're going to be considering here is going to be sea level. And at sea level, the pressure applied by the atmosphere on your body is equal to 760 millimeter mercury. So again, atmospheric pressure applied on your body is 760 millimeter mercury. Anything that we're going to be dealing with is going to be compared to the atmospheric pressure. What this means, if let's say I have a pressure 765 millimeter mercury, in order for us to simplify this number, we won't say it's 765 millimeter mercury, we're going to say it's 5 millimeter mercury. Why? Because we simply gonna be considering the atmospheric pressure as our zero pressure. And any other pressure gonna be compared to this atmospheric pressure, this 760 millimeter mercury. If you have a pressure greater than 760 millimeter mercury, it's gonna be a positive pressure. If I have a pressure lower than 760 millimeter mercury, let's say it's 756. So 756, rather than saying I have a pressure of 756 millimeter mercury, in order for me to simplify this, I would say it's negative 4 millimeter mercury. I have a negative pressure. I have a negative pressure. So again, in order for us to simplify the numbers, we're going to be comparing any pressure to the atmospheric pressure, because simply the atmospheric pressure is applied on everything. So everything gonna have 760 millimeter mercury, which is the atmospheric pressure applied to it. So we're gonna consider this as our zero pressure. What if I have a pressure that is equal to 760 millimeter mercury? So what is gonna be the value that we're gonna be using for this pressure? I got few responding here. We've got 41 participants. I see only 10, 12, 14. Yeah, here we go. More people responding. Yes, exactly. So if I have a pressure equal to the atmospheric pressure, is going to be a 0 millimeter mercury. So any pressure that is lower than the atmospheric pressure is going to be a negative respiratory pressure. Any pressure that is going to be greater than the atmospheric pressure is going to be a positive respiratory pressure. Any pressure that is equal to the atmospheric pressure, it's zero pressure. So what are the effective pressures on here playing a role to move air in and out of your lungs? So we're looking here. This is going to be my trachea. Those are my bronchi. And those are going to be my lungs. If you remember, around your lungs, we've got this membrane that is formed of two layers. A layer adhering to the lung from outside. This is called the visceral layer of the pleura. And lining the thoracic cavity, we've got another layer of the pleura. This is called my parietal layer. And again, the parietal layer is going to be lining the thoracic cavity. Between the ribs on here, we've got the intercostal muscles, and separating your thoracic cavity from your abdominal cavity, you've got a major respiratory muscle. This is my diaphragm. All right, so what are the effective pressures here that will be playing a role in the gas movement in and out of the lungs? First, I need to understand that being connected to the outside I have what pressure on the outside do you have? What is the pressure of air that you have surrounding you right now on the outside of your body? What is the pressure of air? What do we call the pressure of air on the outside? Atmospheric pressure, exactly. And atmospheric pressure is equal to what? It's equal to, our simplified way, it's going to be 0 millimeter mercury. This is the first effective pressure here. 0 millimeter mercury on the outside. Intrapulmonary pressure or intra-alveolar pressure, the same. This is the pressure of air. From its name, it's intrapulmonary, means inside the lungs. Intrapulmonary pressure, you see the lungs or the air sacs are going to be connected to my atmosphere. So air can travel in and out. Remember, anything travels from high pressure to low pressure until when? Until I equalize the pressure on both sides. So from this, putting this into consideration, what's going to be the intrapleural pressure for most of the time? For most of the time, what's going to be my intrapulmonary pressure? If both are connected together, what's going to be your intrapulmonary pressure? For most of the time, it's going to be a 0 pressure. It's equal to the atmospheric pressure, because any change that takes place in my lungs is going to be resulting in air moving in or out of my lungs, keeping the pressure inside my lungs equal to the atmospheric pressure. So it's going to be equal to the atmospheric pressure. In other words, it's going to be 0 millimeter mercury. Exactly like what you're saying. So again, first effective pressures that we're looking at is going to be the atmospheric pressure. Second pressure is going to be the intrapulmonary pressure or intra-alveolar pressure. And intra-alveolar pressure is almost always equal to the atmospheric pressure. For most of the time, the pulmonary pressure, the intrapulmonary pressure is going to be a 0 pressure. It's going to be equal to the atmospheric pressure. Why again? Because simply whenever there will be a change, the pressure is going to be equalized. Air going to flow in or out, equalizing the pressure on both sides between the lungs and the atmosphere. How about my intrapleural pressure? What is the intrapleural pressure? This is the pressure between the two layers of the pleura. This is called my intrapleural pressure. Remember, the parietal layer is attached to the thoracic cage. And remember, the muscles tend to contract, elevating the ribs, so the thoracic cavity tends to expand, tends to move out. Compared to the lungs have lots of elastic tissue, and attached to the lungs wall, we've got the visceral layer of the pleura. So the lungs tend to collapse, to recoil. Your lungs are like a balloon. So if you inflate a balloon and you let it go, what's gonna happen? The balloon, as it has lots of elastic components, it will tend to collapse. It will tend to return back to its initial size, ejecting this air out. So if you inflate a balloon and you let it go, the air gonna be moving out simply due to the effect of the recoil force and the elasticity of the balloon. So the same concept here in my lungs. My lungs are gonna have a lot of elastic tissue, and this elastic tissue will make the lungs have greater tendency to recoil, to collapse. So I have a membrane like this. One side of the membrane is attached to the lungs. The other side of the membrane is going to be attached to the thoracic cage, thoracic wall. It's a closed chamber. Here you don't have any connection to the outside. Again, what is the tendency of the thoracic cage? Thoracic cavity tends to expand, compared to the lungs, tend to recoil. You've got two layers. One layer is attached to the lungs, and the other layer is attached to the thoracic cavity. So what's going to happen between those two layers? If I'm looking here, I have, this is my visceral layer, this is my parietal layer, and in between the two layers, you've got the pleural cavity. So what do you think? Is the pressure inside? Is this going to be a negative pressure or a positive pressure? If you are dragging the two layers away from one another, what's going to happen to the volume of the pleural cavity? What's going to happen to the volume? It tries to expand, right? It tries to expand. And when you increase the volume, what happens to the pressure? Can you remind me? Volume, when increased, the pressure will be dropping. And this is exactly what's going to happen. So here, as I'm trying to pull the two layers of the pleura away from one another, the pressure inside the pleural cavity is going to be dropping, and this is going to be lower than the atmospheric pressure. So the intrapleural pressure is going to always be a negative pressure, always going to have a negative value. Why will it have a negative value? Because simply it's going to always be lower than the atmospheric pressure. And what keeps it negative? Remember, all the time your lungs are trying to collapse, all the time your chest wall tries to expand. And as you're going to be always trying to move the two layers away from one another, you're creating a vacuum in between. And the vacuum going to have a negative pressure, a pressure lower than the atmospheric pressure. Is this clear so far? All right, so what are the effective pressures that we've seen that will be playing a role in the gas movement, in the air movement? First is going to be the atmospheric pressure. Second is going to be the intrapulmonary pressure or the intraalveolar pressure. The third effective pressure that will allow me to move the air is going to be the intrapleural pressure. Yeah, intrapleural pressure, this suction force is what we've studied, if you remember back, exactly, Melissa, is going to be helping with the venous return back to the heart. Exactly. This negative force that you're going to be creating between the two layers of the pleura was considered one of the major factors that will allow you to pull the blood back to the heart. This is what we call back with the heart, the respiratory pump. All right, so again, two pressures that we've seen so far. First one, or three pressures. First one is the atmospheric pressure. Second one is going to be the intrapulmonary pressure, the pressure inside the lungs. And again, intrapulmonary pressure is almost always equal to zero pressure, 0 millimeter mercury. Why? Because it's connected to the atmosphere. Third one is going to be my intrapleural pressure. And the intrapleural pressure is going to be always negative. Always going to have a lower pressure compared to the atmospheric pressure. All right, so looking here at the lung, now I'm drawing the lung as one air sac on here. So this is going to be representing the trachea and bronchi, and this sac on here is going to be representing my air sacs. And surrounding the air sacs of the lungs on here, remember we've got a membrane that has two layers, one covering the lung from outside, so it's going to be my visceral layer, and one that's going to be lining the thoracic cavity from inside is going to be my parietal layer. And this is going to be my chest wall like this. This is just for simplification. And this is going to be here my diaphragm. All right, so what will determine whether this lung is going to be inflated or deflated? So if I told you I want to inflate this balloon, I have a balloon on here, and I want to inflate this balloon. So what will I do? What are the pressures first? We have the pressure of the air on the inside of the balloon, which is equal to the pressure of air outside of the balloon. So what do we call the pressure outside of the balloon? It's going to be the atmospheric pressure. And it's going to be equal to the intrapulmonary pressure, which is the pressure inside this balloon representing the lungs. So how do I inflate this balloon? What do you think? I have two ways to inflate this balloon. Pump air inside. Pump air inside the balloon. Right? So you pump air inside the balloon. So what's going to happen? The pressure of the air inside this balloon is going to increase. And this balloon is going to be inflated. Is there any change that happened on the outside of this balloon, or still having the same pressure? Still have the same atmospheric pressure. Nothing happened to the outside. So what do you think is going to be another way to inflate this balloon? So how do I draw air inside by expanding the volume of the balloon? Like Tyler says here. So you've got this balloon on here, it's deflated. Deflated. I want to inflate it, but without pumping the air in it. I want the air to flow inside of the balloon without me pumping this air. I don't have a pump. How would I be pulling the air inside the balloon to inflate the balloon without pumping this air in? You don't want to pump this air. If you increase the outside pressure, what do you think? What's going to happen? If you increase the outside pressure, will this allow the air in or will move the air out? It's going to move the air out. So what do you want to do for the outside pressure to allow the air in? You need to create a suction force outside of the balloon, and this will allow the balloon to increase in size. As you increase the size of the balloon, this gonna lower down the pressure on the inside, and so the air outside gonna be moving from its high pressure to its low pressure on the inside. So you have two ways to inflate this balloon. Either you pump the air in, you push the air inside the balloon, or you're gonna be applying a negative force on the balloon from outside, vacuum, and this will allow the air to travel in. So from this, putting this into consideration, what will determine the size of the lungs is going to be pressure inside of this balloon and the pressure on the outside. This is what's going to determine the size of the balloon. So if I'm not compressing this balloon from outside, no compression, I'm pumping air in, what's going to happen to the size of the balloon? Size will increase, the volume will increase. So it is the pressure applied inside what causes the increase in the volume of the balloon, the intrapulmonary pressure. What if I am pumping air in this balloon, but in the same time I'm applying compressing force on the balloon? Will this compression help or will be resisting the increase of the size of the balloon? So A helps with the increase of the size of the balloon, B resisting the inflation of the balloon. It's going to be resisting. So the pressure on the inside is not the only factor that's going to be affecting how big this balloon will get. Also, the pressure on the outside is going to have an effect. So pressure inside is going to be helping. If you increase pressure inside, this is going to help the increase in the volume of the balloon. What happens when you increase the pressure outside of the balloon? Compressing the balloon from outside, this will be resisting the inflation of the balloon. Is this point clear? So I'm inflating a balloon. What helps with the inflation of the balloon is the pressure that you put inside. What resists the inflation of the balloon is the pressure that you're applying from outside on this balloon. In other words, what's going to be determining the volume of the balloon is the pressure inside minus the pressure outside. So let's say the same balloon on here, you're putting air, you're pumping air inside this balloon at a pressure of 5. And you're compressing this balloon. Here we're talking about pumping the air in the balloon. We didn't mention yet the suction or the vacuum. All right, bear with me for a few more minutes. All right, so we're looking here. I am pumping the air inside the balloon at a pressure of 5. And I'm compressing the balloon from outside by a pressure of 3. So what is going to be the net pressure that's going to be inflating this balloon? Yeah, you're doing both in the same time. You're pushing air in at a pressure of 5, and you're compressing the balloon from outside by a pressure of 3. So what's going to be the net pressure that allows the inflation of the lung, or of the balloon? Is going to be the difference between the two. So what you did, you checked the pressure inside, and you subtracted the pressure applied outside, from outside. This is what you did. In order for you to tell what is the effective pressure that will determine the size of the balloon, you did what? You did check the pressure inside, and you subtracted the pressure outside. Is this concept clear? Is this concept clear? All right, so let's go back to the lungs. Again, this is my trachea. This is my lung, like this. Surrounding the lung, we've got a membrane formed of 2 layers. Parietal and visceral layers. Outside of the pleura, we've got the thoracic cage and the diaphragm like this. All right, so outside, we've got what pressure? This is going to be my atmospheric pressure. Inside of the lungs, what pressure did you get? You've got the intrapulmonary pressure. And the intrapulmonary pressure is almost always equal to 0 millimeter mercury, which means, in other words, it's equal to the atmospheric pressure. In between the 2 layers of the pleura, we've got the intrapleural pressure or the thoracic pressure. And remember, the intrapleural pressure is almost always equal to, or it's always, not almost always, it's always a negative pressure. The intrapleural pressure, it's 756 millimeter mercury. In other words, can you calculate this for me? How to simplify 756 millimeter mercury? It's a negative 4 millimeter mercury. So we're looking here at the pressures that keeps the lungs inflated. The pressures that keeps the lungs inflated. Again, what is the effective pressure that keeps this balloon inflated? Is the difference between the pressure inside and the pressure outside. So what is the pressure inside your lungs? Here we're looking at this balloon. The balloon here is the lungs. What keeps the lungs inflated? What is the effective pressure that keeps my lungs inflated? 760 millimeter mercury, this is the pressure inside. So pressure inside is 0. What is the pressure outside? What is the pressure outside of your lungs? -4. So pressure inside minus the pressure outside, which is the intrapleural pressure. So 0 minus -4 millimeter mercury. So what is the effective pressure that keeps my lungs inflated? 4 millimeter mercury. This is the pressure, the net effective pressure that keeps the lungs inflated. So if a person got stabbed by a knife here in his chest, so I did break the seal. So I did open the outside layer of the pleura, the parietal layer of the pleura. So what's going to happen here? This pressure is what? It's -4. So the air outside is atmospheric pressure, so it's a zero pressure. So what's going to happen if you break the seal? You open it, the air at zero pressure, which one is higher, zero pressure or -4 millimeter mercury? Zero is much higher than -4, right? And air travels like anything else from high pressure to low pressure. So what's going to happen if you break the seal? Air will be passing from outside of the chest in between the two layers of the pleura. It travels from 0 to -4 millimeter mercury, and as a result, what's going to happen? The intrapleural pressure, rather than being a negative pressure on here, a suction force, it's going to be a zero pressure. It's going to be equal to the atmospheric pressure. So what's going to happen to my lungs? Would they be kept inflated? What is the effective pressure that keeps your lungs inflated? Again, pressure inside minus pressure outside. Normally, pressure inside is 0. Pressure outside is supposed to be -4. So if you break the seal, if I did cut the parietal layer of the pleura, what's going to happen? Air flows inside, and the pressure between the two layers of the pleura is going to become 0 pressure. Remember, air travels from high pressure to low pressure until you equalize the pressure, until the pressure on both sides become equal. So intrapleural pressure, if it drops to 0, what's going to happen? The effective pressure that keeps your lungs inflated is going to be 0 minus 0 equals to 0 minus 0 equals to 0. There. So would I have any effective pressure to keep my lungs inflated? Is there any effective pressure that keeps my lungs inflated? In this case, no. So what's going to happen to my lungs? They will collapse. So if a person got stabbed in the chest, what is the things that you need immediately to not do? What do you think? Don't pull the knife out. Why don't remove it? Why don't remove the knife from its place? Because simply you're going to be opening space through which the air going to be traveling between the two layers of the pleura. If the air moves in, the lungs of the person here is going to be collapsing. There will be no effective pressure to keep my lungs inflated. So again, the effective pressure that keeps your lungs inflated is simply the pressure between the difference between the pressure inside and the pressure outside. Inside I have my pulmonary pressure or intrapulmonary pressure, and outside I have my intrapleural pressure. What do we call this effective pressure that keeps your lungs inflated? The pressure that keeps my lungs inflated is called the transpulmonary pressure. This is the effective pressure that keeps my lungs inflated, which is simply the pressure inside minus the pressure outside. Pulmonary pressure minus the intrapleural pressure. Normally, this is 0, this is -4, so the net pressure that keeps my lungs inflated, my transpulmonary pressure, is supposed to be 4 millimeter mercury. This is the net pressure that keeps the lungs inflated. All right, so how to fix it? You're gonna need to connect the intrapleural cavity to a vacuum. So the air is going to be accumulating between the two layers of the pleura like this. So you need to pull this air out and connect it to a vacuum in order for the lungs to return back to their normal size. All right, and this requires the patient to be hospitalized, or in case of emergency to be for an expert to connect it to a sealed vacuum, to create a vacuum like a bottle with water lower than the pressure, lower than the body level. This creates a vacuum, a suction force that pulls the air down into this bottle. So if you watch the very first, if you watched the Good Doctor series, this was the very first episode on season 1. Right? So in an airport, a child got stabbed in the chest by a glass, and they removed this glass. So what happened? His lungs did collapse, and in order to revert this, you need to connect this cavity, which is now filled by air, to a sealed vacuum, and this vacuum is going to be pulling the air out, allowing the lungs to expand another time. You're creating a suction force surrounding the lungs for the lungs to re-expand back to the normal size. All right, clear? All right, so all this describes all the effective pressure. So let's now check out, so the effective pressure again that keeps my lungs inflated. This is what we call the transpulmonary pressure. According to which you're going to be determining the volume of the lungs. All right, so looking here, how do I allow inspiration to take place? So again, this is going to be my trachea like this, and other parts of the airway connected down to my lungs. Surrounding the lung, we've got the membrane with 2 layers. Visceral layer attached to the lung. Parietal layer is lining the cavity on here. This is my thoracic cage. And this is going to be my diaphragm. So during inspiration, what happens? Outside, I have an atmospheric air at an atmospheric pressure, which is equal to 0 millimeter mercury. Before inspiration, the intrapulmonary pressure, remember, pulmonary pressure is going to be almost always equal to the atmospheric pressure, means the pulmonary pressure or intrapulmonary pressure is going to also be a 0 millimeter mercury. And the intrapleural pressure, it's always a negative pressure. The intrapleural pressure is going to be lower than the atmospheric pressure by 4 millimeter mercury, which will make it negative 4 millimeter mercury. So before inspiration, what was the effective pressure that keeps my lungs inflated, that determines the lungs volume. What was my transpulmonary pressure? Pressure inside, which is my pulmonary pressure, minus the pressure on the outside, which is my intrapleural pressure. So pulmonary pressure is zero pressure, and the intrapleural pressure is going to be -4 millimeter mercury. So the effective pressure that keeps my lungs inflated, that determines the volume of the lung, is going to be 4 millimeter mercury. Anybody has a problem so far? Anybody has a problem? No. All right. So during inspiration, it's an active process. It requires you to contract your respiratory muscles, and the muscle here that's going to be contracting is going to be my diaphragm. So when the diaphragm contracts, it's going to be moving down like this. So what happens to the volume of your chest? When you contract your diaphragm, what's going to happen to the volume of the chest? It's going to increase. When I increase the volume of my thoracic cavity, what's going to happen to the pleural pressure, intrapleural pressure? When you increase the volume of your thoracic cavity. In other words, see on here, this is my diaphragm before I contract it. This is after I contracted the diaphragm. So what's going to happen? If you're putting this layer of the pleura down with the diaphragm, what's going to happen to the intrapleural pressure? If you increase the volume of your chest, when you increase volume, what happens to the pressure? When you increase volume, what happens to the pressure? Decrease the pressure. So what's going to happen to the intrapleural pressure, or another word, another name for it is going to be intrathoracic pressure. The intrapleural or thoracic pressure is going to be decreasing as a result of the increase in the thoracic volume. So when I contract the diaphragm, the volume of the chest increases, and as you increase the volume of the chest, intrapleural pressure will be decreasing. So when I decrease the intrapleural pressure, it was initially -4, so now it's going to become -5, or will it become -3? When you reduce the volume, when you increase the volume of the chest, dropping the intrapleural pressure, so before you contract the diaphragm, the pressure in between the two layers of the pleura, intrapleural pressure, was -4. So when you contract the diaphragm, increasing the volume of the chest, dropping the intrapleural pressure, will it become -3 or -5? If you want to decrease the intrapleural pressure, will it drop to -3 or -5? Which one is lower, -3 or -5? -5, exactly. So as I increase the volume of the chest by contracting the diaphragm, I will have a decrease in my intrapleural pressure, and this decrease is going to be resulting in lower negative pressure. So now the intrapleural pressure will become more negative. So what's going to happen to the transpulmonary pressure when you contract your diaphragm? So rather than being -4, it becomes intrapleural pressure, rather than being -4, it becomes -5. So 0 now minus -5 is going to be, what is the effective pressure that keeps my lungs inflated? Is going to be 5 millimeter mercury. So what's going to happen to the transpulmonary pressure when you drop the intrapleural pressure? It's going to be increased. It's going to be, rather than being 4, it's going to become 5 millimeter mercury. Again, what is the transpulmonary pressure? This is the effective pressure that will be determining the size of the lungs. So now, as I increase the transpulmonary pressure, what's going to happen to the volume of the lungs? What do you think? The lung here, will it increase in size, or I will have a reduction in the size of the lungs? I increase the volume of the lungs. The volume of the lungs is going to be increased. And as you increase volume of the lungs, what's going to happen to the pressure inside the lungs? You increase the volume of the lungs, you're going to have a decrease in its pressure. And what was the pressure inside the lungs? Again, it's my pulmonary pressure, my intra-alveolar pressure or intrapulmonary pressure, which was 0 millimeter mercury. So I will lower the 0 millimeter mercury, rather than being 0 millimeter mercury, it drops to -1 millimeter mercury. I did decrease the pressure. -1 millimeter mercury. What was the pressure outside again? Can you remind me? Atmospheric pressure, which is equal to 0. Which one is greater, 0 or -1? 0 is greater than -1. So what's going to happen? Air travels from its high pressure outside, from the atmospheric pressure, which is 0, to -1 millimeter mercury inside your lungs. Until when? Until you equalize the pressure between the two sides. So now, as I allow the air to travel in, the pressure in my lungs returns back to become a 0 millimeter mercury. So again, what just happened? I contracted the diaphragm. This increased the volume of my chest, my thoracic cage. And as I increase the volume of the thoracic cage, of the thoracic cavity, the intrapleural pressure will drop, decrease. Remember, when you increase volume, you have a reduction in the pressure. Intrapleural pressure before I contract the diaphragm was -4 millimeter mercury. So when you increase the volume of the chest, this -4 becomes -5. I did reduce the intrapleural pressure. So how is this going to be affecting the size of the lungs? Remember, what determines the size of the lung is a pressure called the transpulmonary pressure, which is simply the difference between the pressure inside and the pressure outside. Before inspiration takes place, the pressure inside my lungs is a 0 pressure. And the pressure in my pleural cavity is a -4. This is the pressure inside, this is the pressure outside. Now the pressure outside drops from -4 to become -5. So this results in an increase in my transpulmonary pressure. So now the transpulmonary pressure, rather than being 4 millimeter mercury, it becomes 5 millimeter mercury. And as a result, what's going to happen to the volume of the lungs? The lungs volume will increase. And as you increase the volume of the lungs, what's going to happen to the pressure on the inside? Pressure decreases. The intrapulmonary pressure drops to -1 millimeter mercury, and this what will allow the air to move to the inside of your lungs from outside. As you are moving the air from outside in, remember, air is going to be moving from high pressure to low pressure. In our case, it's going to be 0 pressure outside, -1 inside the lungs. So it keeps moving until the pressure is equalized on both sides. So until the pressure in my lungs returns back to become a 0 pressure. This is how inspiration takes place. Any problem? Any problem? All right, so keep this picture in the back of your mind. How expiration takes place. So remember here, at the end of inspiration, I did just breathe in. I did allow the air to move in. The diaphragm is still contracted. We are still at the end of the inspiration. This is my diaphragm, which is contracted like this. At the end of inspiration, what was the pressure outside in the atmosphere? What was my atmospheric pressure? Still 0 millimeter mercury, no change. At the end of inspiration, after you allowed the air in, I did already allow the air in. So what is the intrapulmonary pressure? Intrapulmonary pressure. After I allow the air in, remember, you allow the air to flow from outside from 0 to -1 until you equalize the pressure on both sides. So the pressure inside your lungs is going to be, at the end of inspiration, is going to be 0 pressure, right? So it's going to be a 0 pressure. So intrapulmonary pressure, it's a 0 millimeter mercury at the end of inspiration. What was the pressure in my intrapleural space, intrapleural cavity? At the end of inspiration, I did increase the size of the chest by contracting the diaphragm, so I have larger volume, so the intrapleural pressure is going to be -5. And if you remember, what was the pressure that determines the size of the lungs? Remember, this is my transpulmonary pressure. And at the end of inspiration, transpulmonary pressure was 0 minus the intrapleural pressure, which has been reduced to -5. So the transpulmonary pressure is going to be 5 millimeter mercury. This is the picture at the end of inspiration. I did move the air in. The pressure inside my lungs is a 0 pressure. It returned back to 0 pressure because of the air that did move in. So what happens during expiration? During expiration, in order for you to move the air out of your lungs, expiration, it's a passive process. So what will I do in order to move the air out? I simply gonna need to relax my diaphragm. And when I relax the diaphragm on here, what's gonna happen to the volume of my chest? Volume of the thoracic cavity is gonna be decreased, right? So if this is a volume at the end of inspiration like this, when you relax the diaphragm is going to be returning back to its place. So what happens to the volume inside in here? It has been reduced. And as you reduce the volume of the thoracic cavity, what was the pressure inside the thoracic cavity? It is the pressure of my pleural space. So intrapleural pressure was -5 at the end of the inspiration. So now when I relax the diaphragm, it will go up or down. What do you think? When I reduce the volume, what's going to happen to, when you reduce the volume, what's going to happen to your intrapleural pressure? Will you increase or reduce the pressure? When I reduce the volume, what happens to the pressure? Pressure goes up. Exactly. So now I relaxed the diaphragm. This will reduce the volume of my chest. And as I reduce the volume of the chest, what's going to happen to the pressure? Pressure going to go up. So rather than being -5, when it goes up, it's going to be less negative. It's still going to become, it's going to always remain a negative pressure because this is what keeps your lungs inflated. But rather than being -5, it's going to increase to become -4 millimeter mercury. How is this going to be reflected on the transpulmonary pressure, the effective pressure that keeps your lungs inflated? So rather than having this -5, it becomes -4. So now 0 minus -4 is going to be equal to 4 millimeter mercury. So what happens to the transpulmonary pressure? The effective pressure that keeps my lungs inflated. What happens to the transpulmonary pressure? Did I increase it or reduce it? Moving from 5 to 4. So again, here we're looking at intrapleural pressure. Intrapleural pressure, when you reduce the volume of the chest, what happened to it? It did increase, right? I increased what? Intrapleural pressure, the pressure between the two layers of the pleura. And when you increase the pressure from -4 to -5, the effective pressure that keeps my lungs inflated, transpulmonary pressure, is equal to the intrapulmonary pressure, which is 0, minus the intrapleural pressure. So at the end of inspiration, it was -5. Now it becomes -4. So 0 minus -4 is going to be 4 millimeter mercury. So what happened here to the pressure that keeps my lungs inflated? Rather than being 5, it becomes 4. So I started by 5, I will become 4. So what happened to the pressure? Did it increase or decrease? The pressure that keeps my lungs inflated, has it increased or decreased? decreased, right? And when I decrease the transpulmonary pressure, what's going to happen to the lungs volume? Again, what is the transpulmonary pressure? This is the effective pressure that keeps your lungs inflated. So when you reduce this pressure, what's going to happen to your lungs? Volume, the lungs volume will decrease. And as you decrease the lungs volume, what's going to happen to the pressure inside? If I reduce the volume, what happens to the pressure inside? Pressure goes up. So rather than being 0 on the inside, it's going to go up to become 1 millimeter mercury. Am I connected to the outside? Am I connected here? Am I connecting the lungs to the outside? Yes or no? Yes. So inside of my lungs, after I relax the diaphragm, this gonna cause a reduction in my transpulmonary pressure, reducing the lungs volume. And as you reduce the lungs volume, the pressure gonna be increased from 0 to 1 millimeter mercury. So inside the lungs, I have 1 millimeter mercury. Outside of the lungs, the atmospheric pressure is still 0 millimeter mercury. It's still my zero pressure. So which one has a greater pressure, your lungs or the atmosphere? Which one has a greater pressure, your lungs or the atmosphere? Lungs. One is greater than 0, right? So air will flow from where to where? From lungs that has 1 millimeter mercury to the atmosphere that has a 0 millimeter mercury pressure. Which one would it move for? Would the air move from the lungs to the atmosphere or from the atmosphere to the lungs? From high to low, in other words, it's going to be traveling from the lungs, which has 1 millimeter mercury, to the atmosphere, which has a 0 millimeter mercury. So what's going to happen to the air? Air going to flow from your lungs out. Until when? Until you equalize the pressure, until the intrapulmonary pressure returns back to become a 0 pressure. That's why when we discuss the pulmonary pressure or the intrapulmonary pressure, we mentioned that it's almost always equal to 0. It's not always 0, it's almost always. Because during inspiration, what happens? You have dropped the pressure to -1 millimeter mercury, and then the air flows in to equalize the pressure again, and the intrapulmonary pressure becomes 0 another time. During expiration, as you relax the diaphragm, the intrapulmonary pressure gonna increase to become a 1 millimeter mercury, and as a result, air will flow outside of your lungs to the atmosphere, and this will drop it back again to a 0 millimeter mercury. So it's almost always going to be a 0 millimeter mercury. It's almost always equal to the atmospheric pressure. Why it's not always? Because you're going to slightly increase and decrease the intrapulmonary pressure, and this slight increase or decrease in the intrapulmonary pressure is what allows you to move air in and out of your lungs. Is this clear? Anybody has a problem with the concepts on here? On how air moves in and out of the lungs and according to what pressures? All right, so let's read this part from the slides on here. Outside, I have again my atmospheric pressure. Inside the lungs, you have the intrapulmonary pressure, which is almost always equal to the atmospheric pressure, 760 millimeter mercury. Outside, between the two layers of the pleura in the pleural cavity, we've got the intrapleural pressure, which is going to be lower than the atmospheric pressure. And it's going to be always negative pressure. Most of the time, it's going to be negative 4 millimeter mercury. Those are the effective pressures. What keeps the lungs inflated is going to be determined by the difference between the outside pressure and the inside pressure. This is what we call the transpulmonary pressure. Inside, if it was 760 millimeter mercury, outside it's 756 millimeter mercury. So the effective pressure that keeps your lungs inflated is going to be the difference between those two pressures. Pressure inside minus the pressure on the outside. So again, outside pressure is going to be always a negative pressure. So I will have always a positive result for the transpulmonary pressure. And if this positive pressure drops to 0, this means that I have no effective pressure to keep the lungs inflated and the lungs will collapse. Important concepts that you need to be aware of, that gas is always going to be traveling from high pressure to low pressure. Always something that you need to pay attention to is the relationship between the volume and the pressure. As I increase the volume, pressure decreases. And as I reduce the volume of a container, the pressure inside the container is going to be increased. Inspiration is an active process. It requires muscular contraction. So inspiratory muscles need to contract. And as I contract the inspiratory muscles, the thoracic volume will increase. As we've seen on here, I contracted the diaphragm. And as I contract the diaphragm, this increases the volume of my chest. Also, intercostal muscles might be used if you are trying to breathe harder. So the intercostal muscles, when they contract, they will be elevating your ribs, expanding the chest. So in both cases, you are required to contract your respiratory muscles, either the diaphragm only, or you add on top of the diaphragm other muscles like the intercostal muscles. As I increase the volume of the chest, the intrapleural pressure gonna drop. As interpleural pressure drops, the transpulmonary pressure will increase, and so my lungs volume. As you increase the lungs volume, the lungs pressure gonna be decreased, and it drops lower than the atmospheric pressure until when? Until you allow the air to flow in your lungs. And as the air flows into the lungs, the pressure will be equalized. Intrapulmonary pressure is going to return back to become zero pressure. Respiratory muscles, diaphragm, and the ribs. Diaphragm descends and the ribs going to be moving up. This increases the thoracic cavity volume, and as we've mentioned, the transpulmonary pressure as a result will increase. This causes the stretch of the lungs, increasing my intrapulmonary volume. And as I increase the intrapulmonary volume, the intrapulmonary pressure drops to -1 millimeter mercury. Remember, gases will be moving to the inside of the lungs as the gas is going to be moving down their pressure gradient. From outside, atmospheric pressure is a zero pressure, and inside is going to be a -1 millimeter mercury. So air flows in the lungs until I equalize the pressure on both sides, and the lungs pressure, the intrapulmonary pressure, becomes zero another time. It will increase back to zero. What happens during expiration? Expiration, on the other hand, it's going to be a passive process. It's normally a passive process. Quiet expiration is a passive process. You don't need to do massive contraction normally to push the air out of your lungs. You're going to just need to relax the contracted respiratory muscles. As you relax the respiratory muscles, the thoracic cavity volume will decrease. This decrease in the thoracic cavity volume will increase the intrapleural pressure, and this results in a reduction in the transpulmonary pressure. Decrease in transpulmonary pressure is what's going to result in the increase in the reduction in my lungs volume, and as I reduce the lung volume, its pressure will increase to become a pressure of 1 millimeter mercury. Remember, 1 millimeter mercury in your lungs is greater than the atmospheric pressure. So what's going to happen? Air will flow out of the lungs down its pressure gradient until the pulmonary pressure becomes zero another time. All right, so inspiratory muscles, when they relax, this will reduce the thoracic cavity volume, and as I reduce the thoracic cavity volume, the lungs will recoil passively, intrapulmonary volume will decrease, and as a result, this increases the intrapulmonary pressure to become 1 millimeter mercury. As you increase the pressure inside your lungs, remember, air flows out of the lungs down its pressure gradient, and the pulmonary pressure at the end of expiration gonna return back to 0 millimeter mercury. For question number 5 today, please check here this question. The functional unit of the lung is found in what part of the lower respiratory system? Am I still connected? Anybody is here? So the functional unit is what allows my gas exchange to take place. So where do I have the gas exchange taking place? Remember, in your respiratory zone. Again, what are the different parts that will allow the gas exchange to take place? Those are the respiratory bronchioles, What else? What else other than respiratory bronchioles? Can you remind me, please? Air sacs formed of which are full of clusters of alveoli. Can you remind me how many alveoli do you have in your lungs? 300 million of them. 300 million of them. What was the third one? So we've got respiratory bronchioles. We skipped one. Then you told me air sacs with the alveoli. Third part is going to be my alveolar ducts. Alveolar ducts. So which one of the three again allows gas exchange to take place? Which one of the three allows gas exchange to take place? All of them. All of them will allow gas exchange to take place. And where is most of the gas exchange going to be taking place? Most of the gas exchange is going to be taking place in my air sacs, alveoli. Right, questions? All right, so you have just those 5 questions for the in-class activity for today. All right, so again, please make sure you are adding those every time we're meeting to the file that you're preparing to submit towards the end of the semester. Updates will follow concerning the proctored lab exams. I will be updating you when they are ready. All right. Any questions for me?